Hello and welcome to Joy in Our Town. I'm excited to be your host on today's show, Copelia, and really excited to introduce to you our two guests, and we'll get to that in just 1 minute. We're going to be talking about the issue of health, which we're all concerned about. We all want to live a healthy life. And the topic today is preventative dental care. And I know when we say dental care, a lot of people run for the hills because we're all afraid of the dentist. I'm very blessed to have a wonderful dentist, and I'm about to introduce you to two other wonderful dental professionals. We have with us today Dr. Donald Cohen, Oral and Maxillofacial Surgery, Houston Oral Surgery and Dental Implant Center. Dr. Cohen, thank you for being with us.
Thank you.
We don't have to be afraid of you at all.
Not at all. Not at all.
And our other guest, the beautiful Dr. Ashley Marcks, dentist with the Cambridge Dental Inc. office. And thank you for taking time, both of you, for being here on Joy in Our Town.
It's our pleasure.
There's no need to be afraid of either of you.
No dentistry today.
But it is important to know how our dental health affects our overall health, which is why we're talking about this today on Joy in Our Town. And Dr. Marks, why is preventative dentistry so important?
Preventative dentistry is so important because we're catching disease in the early state, not only with your mouth, but the oral cavity is a gateway to other systems in your body. So it's been linked to like diabetes and heart, cardiovascular problems and things like that. But also we're catching cavities early. So if you have a cavity, it can be just filled. But if you wait, because you're afraid of the dentist, it could turn into a root canal or extraction and you're in a lot of pain and it's very uncomfortable. We're also doing screenings for oral cancer and trying to catch that in the early stages. And so every time a patient comes in, we do a quick screening, and if we see something suspicious, we can send it to Dr. Cohen.
And make sure that we catch it early, because that's the key to getting better treatment.
Everything.
Well, I would add that also whenever we have a patient that comes in, no matter what the reason that we see them, we do routinely an oral screening exam, looking at the entire mouth and the supportive structures in the floor of the mouth, under the tongue, into the neck area as a routine basis, and then we usually focus on the reason that they've been referred to our office for their surgical needs.
Right, and it might be a funny kind of comparison, but I think people sometimes take better care of their car. We know that if we do maintenance on our car, we have fewer issues in the long term. If you wait until the car basically breaks down, it's going to be a lot more expensive. Kind of the same with dental health. If we do those preventative checkups, those 6-month checkups, you get things early, you keep your mouth healthy, and you run into fewer problems. Would that be correct?
Yeah,
absolutely.
So we need to take care of our teeth.
Yes.
Yes, we do.
So how can we be sure, especially for those of us who are parents, that our children's teeth are getting clean, especially after brushing?
That's really tough. Some people will say that up to 8 kids don't really have the dexterity to brush properly, but not every parent's going to brush their kids' teeth. So you can maybe make it into like a game, and they have the colored mouth rinses that'll stain your teeth where the plaque is. So you have to get all of it off. So there's just little games you can do to try and encourage kids to brush and brush properly.
That's really good. And would both of you doctors recommend that the children do it both at night and in the morning?
Yes.
Oh yes, absolutely. There's no question about that.
Yeah.
Absolutely. Because I know sometimes my kids just want to go to bed after eating dessert.
No.
No.
Okay, guys,
No.
you're watching the show. The doctor just said we need to brush our teeth.
That's
at night?
probably the most important time, because whatever you've had for dessert, if it contains sugar, and find me a dessert that doesn't, will
Well,
linger.
even fruit. Fruit has the
Yeah.
natural sugars.
Fruit has sugar in it too. That's right. So the sugars will allow the carbohydrates to metabolize, and when the carbohydrates are metabolized, then acid is formed, and that's where the decay comes from.
Right.
So that's the most important time to get that plaque off your teeth.
Well, we're getting a lot of really good practical advice from our doctor guests today. Are there any foods that we can eat just for us and for our children to improve our dental health?
More than what you should eat, it's what you shouldn't eat. And also the frequency of eating. So sipping on a all day is worse than just drinking it in one sitting, because
Really?
Yeah, because the pH in your mouth is constantly at a lower pH, and that promotes decay. But also things like bananas, those stick to your teeth, chips stick to your teeth. So it's all about like moderation and just making sure you like rinse with water or something afterwards.
That's good. So the sodas aren't really good for our health anyway.
No.
But if you're gonna drink one, you're saying drink it in a sitting, not just
Don't
carry it
sip on
around
all
and
day. And also with kids is juice. Juice is a huge issue with all the pediatric patients I see.
wow.
Putting juice in a bottle is like one of the worst things that you can do. So, because they're constantly just sipping on it all day long, and that leads to really bad decay in children.
What would you recommend for parents watching Joy in Our Town today that they should put in the baby's bottle?
Water,
Water.
yeah.
Water's the best choice.
Yeah.
Water's your best choice.
That's great. For any age or just for toddlers, for babies?
Water's great for everyone.
It is. It is. Everybody needs to be drinking more water
Yeah.
Right.
from a dental health standpoint
From
or a general
everything.
medical health standpoint.
You feel better. I drink like a couple liters of water a day, and like on the days that I don't drink that same amount, I feel worse.
That's good to
So-
know. And your skin's glowing, so
Oh,
that must
thank
be
you.
the water.
Yeah.
It's beautiful.
She's well hydrated.
But it's a good reminder for all of us, really, for the health of our teeth and for our well-being. So should children get sealants to prevent cavities as part of the preventative care?
Yes. I think maybe not every kid will need a sealant, but anytime you have those deep grooves in the teeth, that's just spots where the bacteria like to hang out and cause problems. So
What would be a good age that children, when the dentist, you check the kids out, what would be the average age that you recommend sealants?
we'll even do sealants on the kids who come in with their baby teeth. Because I know people often think, oh, well, they're going to lose them anyway. Well, they're actually holding space for the adult teeth to come in. So you want to keep them there as long as possible. And if there's decay, sometimes we can't save the teeth, and then you lose that space, and it leads to more problems in the future. So we'll seal primary teeth, and then whenever the adult teeth come in, we'll seal those as well.
That's good advice. And
Yeah.
for parents who are viewing, what would be the best age that you recommend for parents to bring in their children to get their first visit with the dentist?
Whenever their first tooth comes in. But usually by 6 months, and then we'll see them every 3 months after that.
Okay, so with
Yeah.
with babies, you see them a little more frequently than the 6 months.
Well, really, that is all dependent on, I see adults sometimes every 3 months, and it depends on what they need.
Their situation,
Yeah.
but that's why preventative care is so important.
Yeah.
You know, one of the factors that I try to instill in people with their children is that if you take your child to the dentist when they don't need anything done, then they get used to going to the dentist, and then they're not scared of going to the dentist if they have a problem. It's the child that doesn't see the dentist until they have a problem, and then they're going to have a local anesthetic injection, a
Right.
filling done, and it's going to be more than likely traumatic to some extent. And that's how these psychological fears are developed that we see in so many adults. They remember going to the dentist as a kid, and they remember how terrible it was.
Oh,
So if you can ease them in to the dentist's office, like Ashley said, take them when they get their first tooth. They're not going to need anything, but they're used to the routine.
right,
And they'll
right.
hop up in the chair and be happy to be there.
Right, and a lot of dental offices, especially when you treat kids, there's stickers, because I've seen it with my own kids, they have little treasure boxes that they can go pick a toy.
Make it fun.
Yeah.
Right,
Make
and my
going
kids
to the dentist
far,
fun.
so far have enjoyed their dentist visits, so
Good.
we're
That's
very
great.
excited about that. So we've talked about how often we should visit the dentist, when do we take the babies to the first visit. Dr. Cohen, tell us about what's new in dental technology.
Well, dental technology is always evolving because people are looking at new things and ways to be inventive and more thorough and more efficient. One of the things that we see used now in the dental office on a routine basis, especially in my practice, is three-dimensional imaging, where we don't just take a regular x-ray, we can actually take what's called a cone beam CT, which is a three-dimensional film. These x-ray machines are much less, you have much less exposure to radiation than a hospital CT. I think many people know about that. So we can get a good look at the oral structures. We can look to see where teeth are in the jaw if they haven't come into the mouth.
Wow.
We can look at the bone structures. We can evaluate pathology. Also in technology, there's the use of dental lasers. Lasers are now being used for periodontal treatment. They're being used for cutting procedures in the mouth. And they are looking towards using lasers and actually doing removal of decay and helping with creation of the cavity preparation for filling when you have a cavity.
That's really interesting, and you often hear with plastic surgery, lasers take fewer days to recover when they use specific treatments. So would that be the case with dental as well?
Well, the cutting, the injury that is involved with an incision made by a carbon dioxide laser, which is what I've got experience in, is much less than with an electrical type cutting, what people would call a cautery. It creates less of a thermal injury because of the way that it actually makes the cut by causing the cells to disrupt. And then one of the other big things that goes along with our cone beam CT is that we can now take those images and put them in the computer and actually do virtual surgery.
Wow.
Whether we're moving jaws around or whether we're doing dental implants. We can actually do the surgery in the computer virtually, and then we can transfer that to a guide that can assist us at the time of surgery for accurate placement of either implants or positioning of the bones.
That's fascinating. And for our Joy in Our Town viewers, it can give you a little bit more peace when you go to your dental surgeon or you go to your dentist, that these new technologies are really going to help that visit. You know, the work will be done more precisely, and the recovery time will be less when surgery is needed. So that's really good. If you've been enjoying our program and you'd like to get in touch with either Dr. Cohen or Dr. Marks, look at the screen and we'll be sharing their contact information in just a minute. So Dr. Donald Cohen, our special guest here on Joy in Our Town, oral and maxillofacial surgery. You'll see the information here on the screen. With Houston Oral Surgery and Dental Implant Center. They're located at 6560 Fannin Street, Suite 1522, Houston, Texas 77030. The phone number is 713-790-6477, and it's HoustonOralSurgery.com. Now for Dr. Ashley Marks, if you'd like to get in touch with Dr. Marks, she's a dentist with the Cambridge Dental Inc., and they're located at 8526 Cambridge Street, Houston, Texas 77054. The number to call is 713-790-1111, and it's CambridgeDentalHouston.com. In closing, do either of you have any closing comments you'd like to share? Just remind people to get their preventative care.
Yes.
I think it's important for people to see the dentist on a regular basis. Many times they see the dentist more often than they see their doctor. And we are then charged with examining the patient and encouraging them to seek medical care.
We take blood pressure at every appointment too.
That's good. So you really
Mm-hmm.
watch out for the general health of the people who are getting their preventative care. So as a Joy in Our Town viewer, we want you to be healthy. We want your kids to be healthy. So make sure you get those dental checkups if you haven't booked them yet. Thank you so much for watching the show. Thank you, doctors, for being with us today. We really appreciate it.
It's our pleasure.
And thank you for watching. We'll be back with more Joy in Our Town.
Hi, Julia. Nice to see you. For today's visit, we're going to check your blood pressure and your weight. You know the routine. Oh, and I highly recommend that you get a flu shot today.
Well, why do I need a flu shot?
When you're pregnant, your body changes. You know this. And you're at risk of getting very sick from the flu. This can cause real problems, not only for you, but the baby too. If you get a flu shot today, you can pass on protection from the shot to your baby now, and even after the baby's born.
But is it safe?
The vaccine is very safe. It's been given millions of times, including to pregnant women just like you. The shot can't give you the flu. In fact, it can protect both you and your baby.
Okay, I'll do it. I want to be healthy and protect my baby.
Protect yourself and protect your baby. Pregnant moms, get your flu shot today.
Welcome back to Joy in Our Town. I'm Copelia, and our special guest with the discussion of this issue of health and the topic of oral surgery, Dr. Donald Cohen and Dr. Ashley Marks. Welcome to the show. Thank you so much for being on Joy in Our Town.
It's our pleasure.
Yep.
We're glad to have you back for another segment. And for this particular segment, we're talking specifically about oral surgery. And Dr. Cohen, you are an oral and maxillofacial surgeon.
That's correct.
For a lot of people saying maxillofacial, it's like, How do I say that again? What exactly is an oral and maxillofacial surgeon?
We are a specialty of dentistry that is dedicated to the diagnosis, treatment, and supportive care of the diseases, injuries, and defects of the mouth and supportive structures.
Do you see a lot of athletes with injuries, that kind of injury?
We see a number of athletic type injuries, people that fall, car accidents, all types of injuries. We also see a lot of pathology. People have growths in their mouths that we treat. Those are the diseases. We see teeth-associated diseases. We see non-teeth associated diseases like in your cheek, on your tongue, under your tongue, and the floor of the mouth.
And it's not just the dental area, it's also like the surrounding the jaw, that whole way the face is affected.
We look at the entire, what we call the maxillofacial region, which is everything from your eyes down to your neck, your collarbone. We look at that entire area with our cancer screening that we do on every visit when a patient comes in. We examine them carefully before we address their specific problem, looking for anything that's unusual.
That's really good to know because it's people might not be sure where they should go if they have a concern. That would be the place to go. So let's talk a little bit more about those complicated situations that may require oral surgery. What are some of the most common conditions that might require oral surgery?
The most common thing that I think most oral surgeons sees is the impacted wisdom teeth, that children in the late teen years, 16 to 18, develop problems with their wisdom teeth. Many times we see them to have the teeth removed before they have a problem because we know pretty well that approximately 95% of people will have trouble with their wisdom teeth at some time. So it's best to get them removed at an early age before the teeth have complete their formation, and that way the teeth are easier to get out because the roots haven't fully formed and there's less trauma. The healing is quicker, and the area where you've taken the tooth out fills in with bone better when the child is young and more able to grow bone rather than when you're an adult and you may end up with a bone defect.
Wow, I hadn't thought about that. And as a dentist, Dr. Marks, you'll see a lot of patients that you might feel like they're good candidates. What are some of those things that you might be looking for that you would refer a patient to an oral maxillofacial surgeon?
Almost every wisdom tooth I'll send.
Almost all of them.
Yeah, because they're just usually nothing but trouble. Like they come in at funny angles and they can actually affect the tooth in front of it. So you end up losing not just your wisdom tooth, but another tooth as well.
If you don't treat them ahead of time.
Yeah. So they become food traps, and then sometimes some of the gums cover part of the wisdom tooth, and then food gets stuck under there, and that leads to like a really big infection.
Wow.
So, you know.
So again, going back to preventative care, that would be a really good thing
we're
to deal
general
with.
dentists are like the, you know, you see your primary care physician once a year, and like you come to the general dentist twice a year, and we can point you in the right direction of where to go.
That's really good, and that goes back to, you know, catching things early so that the surgeon doesn't have to do too much to fix a problem that could have been fixed with less surgery maybe in an early stage.
The other thing that to mention about oral surgery or oral and maxillofacial surgery, we are the only specialty in dentistry that is hospital trained. In other words, we do our training in a hospital setting, so we are familiar with hospital ways of taking care of people that are severely injured or very sick. So we see a lot of people in the hospital, and we also do surgery in the hospital when necessary for trauma patients and such.
Wow.
The other thing that we can do also is anesthesia in the office. We can provide sedation up to general anesthesia where people are put to sleep and actually have their surgery done in the office, whereas they don't have to go to the hospital to have that done.
Right, and that includes just a shorter recovery time if it's done quicker, and
it's done quicker.
No hospital stay, no overnight.
There's no overnight stay, and we can provide the patient with not really knowing what happens during the surgery.
Which a lot of people would rather not know.
Most people don't want to know.
Whenever a patient's like, well, what do you think? Should I have sedation? I say absolutely, 100%. Why do you
my
want to be
sister
awake?
always says, just say yes.
Just say yes.
Check the box. So how is the scope of oral surgery different than that of regular care? I think we've touched upon that a little bit, but just in more in depth.
Well, we don't do any type of general dental work.
So
We don't clean teeth, we don't fill teeth, We are, as we like to say, unfortunately, we're the end stop for a dental disease sometimes.
Right.
Because if you have a bad tooth and it can't be fixed, then many people find their way to our office one way or the other to have the tooth removed. Then
Right.
we have to begin the process of helping the patient determine how best to replace that tooth for their function and appearance.
Right. And Dr. Marks, you were going to say something.
Oh, no, I forgot.
Well, no, we're talking about the differences between oral surgery
Yeah.
and regular dental care.
Yeah.
And Dr. Cohen, you mentioned, cleanings and fillings and that
Yeah.
type of stuff. And that's more of what you guys would do.
So we kind of look at everything as a whole. When we send something out or a patient to a specialist, it's for a specific procedure. And we work closely with all of the specialists, and especially with implant placement and stuff, because we're the ones who are going to end up making that tooth look like a tooth again. But it also depends on where, the surgeon places everything. But then there's dentures and just anything you can think of. We do a little bit of everything.
Right.
But because we do so many different things, we can't do more difficult procedures,
And that's where the oral and maxillofacial surgeon comes
We
in.
handle complicated extractions, difficult extractions, multiple extractions. We can rebuild the bone, we can shape the bone.
Wow.
We can replace missing teeth with dental implants. We were talking earlier about technology. One of the greatest things that's come along in my career is the fact that we can now place a titanium fixture in the bone and then have that support either a tooth or a portion of a bridge that will replace missing teeth. And we do this now for most people instead of doing bridge work, which has to cut down 2 adjacent teeth on either side of the gap.
Wow.
And then you're putting those teeth at risk. So by replacing a tooth with an implant, it gives someone the feeling of having a natural tooth, the ability to clean their teeth much easier because there's no attachment to an adjacent tooth. It's a freestanding tooth, just like a natural tooth.
So what's the main difference between what used to be done with those bridges that shave down the other teeth and now, other than putting the other teeth at risk?
Go ahead.
I mean, he touched on most of it, but what I'll always tell patients is, it's not a matter of if this bridge is going to fail, it's when it's going to fail. And implants just have a better prognosis over time because you can keep them clean easier, and you're not putting that added pressure on the adjacent teeth.
Right.
So
Who would be a good candidate for that kind of procedure?
For an implant, anyone that's missing a tooth.
yeah.
And do you see a lot of cases, mostly older people who lose teeth due to decay, or are there different situations that you
There's
see?
a lot of different
A
situations.
lot of different.
Yeah.
It can be any age, any stage. What are some examples?
I treat a number of young people in their late 20s, early 30s, especially males that have had
Sorry.
elbows.
What have they done?
Yeah, what have they done?
I was just
They
gonna
play basketball.
Oh,
Yeah.
sport injuries.
And they get an elbow to the mouth, and it traumatizes their front tooth. We see people that just develop problems with their front teeth. Kids fall down
Right.
when their teeth are in their mouth. They traumatize the tooth dies. It needs to have a root canal done. Then the tooth root may resorb, and they lose the tooth. And they could lose it at any age, from mid-20s up until much later in life. So when you think about your teeth and you look in the mirror and you smile at yourself, think about what it would be like if you lost your front tooth.
Right.
And how can you replace that and make it look natural and long-lasting? Well, one of the best ways to do that is with an implant. And we can rebuild bone if necessary, if bone is
Wow.
lost. We have ways now, new technology again. We have materials that we can use to rebuild the bone such that you can make enough bone if there's not, such that you can place an implant and preserve the structure of the gum tissue so everything looks just like a natural tooth.
It's incredible the kind of things that you guys are able to do. It's
fun.
fascinating.
It's a lot of fun.
Rebuilding, and it's fun.
It is fun.
It's
Bones
an art.
and
It
gums.
is fun. Well, when you see someone that's been injured, you see someone that has a missing front tooth, no matter what. It's a devastating loss. People cry when they lose their front teeth.
Because it affects
And
the way you present
Yeah.
yourself.
Everything.
In a job interview, you
don't
feel
wanna-
self-conscious.
You don't want to smile, you don't want to talk, you don't want to go out in public. It's very humiliating for people. And you've got to help them get through the psychological aspects of what you're going through, because the whole process of replacing the tooth does take time. It can't be done in 1 or 2 days.
Right.
It's a work, and it takes time.
But in working together with regular dentistry and oral maxillofacial surgery, you're able to help these people, in some cases, get their lives back.
Yeah, and just like the change in their just demeanor, they're so much more confident once everything is done. It's
Right.
amazing. I mean, I had a patient who would come in like sweatpants, and by the time we were done with his treatment, he was like in like a button-down shirt and khaki pants, and just like, wow, like could just like, because he just felt better overall
About himself.
Yeah.
That's incredible. Well, I want to share with our viewers, our Joy in Our Town viewers, thank you so much for watching. I want to share with you the contact information for you to get in touch with Dr. Cohen or Dr. Marks if you feel like that's something that you need to do. Maybe you feel like you've needed help and you haven't known who to go to. This would be the information to contact. So Dr. Donald Cohen, oral and maxillofacial surgeon with the Houston Oral Surgery and Dental Implant Center. They're located at 6560 Fannin Street, Suite 1522, Houston, Texas 77030. The phone number is 713-790-6477, and it's HoustonOralSurgery.com. Now for Dr. Marks, Dr. Ashley Marks, dentist with the Cambridge Dental Inc., they're located at 8526 Cambridge Street, Houston, Texas 77054. The phone number 713-790-1111, and it's CambridgeDentalHouston.com. And in this last minute of our segment here on Joy in Our Town, do you have any closing comments?
I would just like to make a quick statement that, in a way, to give back to the community, I'm organizing a group to take applications and provide a complete dental makeover for someone in need. So far we have received 540 applications.
Wow.
And we're getting ready to begin going through those to look for someone. We're also beginning a program to go to middle schoolers and educate them on what it takes to be a medical or dental professional.
That sounds amazing. I hope a lot of people get to benefit from that and maybe make it a yearly thing, because I know there's a lot of people who need it. Maybe you watching Joy in Our Town, you've been motivated and inspired to take care of your dental health, because it really does make a difference in our quality of life. Dr. Cohen, Dr. Marks, thank you so much for being on the show.
Thank you for having us.
And thank you so much for watching. We'll do this again on our next Joy in Our Town. I'm Copelia. See you next time.
The views and opinions expressed on this program do not necessarily represent those of KETH-TV or its management.